Donald Trump's verbal attacks on the World Health Organization have been escalating for weeks. He's accused it of not being transparent, failing to share vital information, and covering up for China. Now he's suspended all US contributions to the agency.
The WHO failed in this basic duty and must be held accountable. It's time, after all of these decades. The WHO failed to investigate credible reports from sources in Wuhan that conflicted directly with the Chinese government's official accounts.
The WHO's budget for this year is around $4.8 billion. It's funded by member states through compulsory and voluntary donations. The US is its largest donor. This year it contributed almost $58 million. China has paid around half that, while Japan has provided $20.5 million. The WHO says it regrets Trump's decision and has called for global solidarity.
When we're divided, the virus exploits the cracks between us. We're committed to serving the world's people and to accountability for the resources with which we're entrusted. In due course, WHO's performance in tackling this pandemic will be reviewed by WHO's member states and the independent bodies that are in place to ensure transparency and accountability.
China also criticized Trump's announcement.
Currently, the world is in a dire situation in terms of the epidemic and at a key stage. The decision of the US will undercut the ability of the WHO and damage the global cooperation in fighting the epidemic. Every country in the world will be impacted, including the US, and especially weak countries. We urge the US to fulfill its obligations and support the WHO.
The condemnation has been echoed by many countries as well as influential figures, including Bill Gates, who's contributed millions of dollars to public health care. The Microsoft co-founder has tweeted that halting funding during a global health crisis is as dangerous as it sounds, saying the world needs the WHO now more than ever. Trump's decision comes amid growing criticism of his administration's handling of COVID-19. The US is the worst affected country, reporting more than 3 times as many cases as any other nation. It's led to accusations that by blaming the WHO, Trump is hoping to divert attention from the rapidly escalating crisis at home. Shamim Chowdhury, TRT World.
Well, for more, let's go to Andrea Feigl in Washington. She's the founder and CEO of investment firm Health Finance Institute. Welcome to Money Talks, Andrea. Now, the US is by far the World Health Organization's biggest contributor. On average, it contributes around $400 million a year. Just what big of impact will a cut in US funding have on the organization's work?
Thank you so much for having me. And absolutely, by contributing $400 million a year, which is about 15% of the assessed contributions, that's a large benefit for the world and world health. Now, if that funding was cut, and to put it in context, WHO has asked for $1 billion to respond to the coronavirus crisis. That would mean it could potentially push another $500 million of people into poverty. It can put already non-existing or fragile health systems at risk. And even if you look at it from a self-interest perspective, the way the epidemic looks, it could re-emerge in our parts of the world. So it is not just in the interests of those countries in sub-Saharan Africa that are now facing an oncoming pandemic. It's also in the best interest for the health and wealth of Western nations to keep supporting WHO.
Now, the World Health Organization, as we know, has come under fire on a number of fronts. For example, it's been accused of responding too slowly to the outbreak. Critics say the WHO failed to push back when China effectively silenced those whistleblowers in Wuhan who wanted to raise the alarm about this new coronavirus. It's also come under fire for barring Taiwan from membership, with the critics saying that it's basically deferring to China in doing this. So does Donald Trump make some valid criticisms when he justified this funding cut?
I think there is a time for criticism and there's a time for solidarity. And right now, we are in the middle of a growing global pandemic. We had over 2 million cases and about 125,000 deaths, 25,000 of which on US soil. So right now, the whole world needs to rally together, and the World Health Organization is the global organization that can work across 180 actors, and hopefully, as you mentioned, Taiwan, perhaps even more in the future. But at present, we really need to work together and enable the one organization with a global reach, because this pandemic knows no borders. And once we have conquered it together with the support of the World Health Organization, I think then it's the right time to say what could have gone better.
Yes, and it's easy to forget that the WHO's work extends far beyond this coronavirus pandemic. Can you just give us an idea of the other activities that the World Health Organization is engaged in around the world?
Absolutely. So just for example, around this pandemic, 133 countries have received equipment and technical assistance in this very pandemic. There is a global WhatsApp chat that experts are answering questions from literally anyone. But the World Health Organization has a much larger umbrella, from polio to HIV/AIDS, to non-communicable diseases like cardiovascular disease, diabetes, which we know are risk factors that make people more susceptible to contracting this virus, strengthening health systems, leading countries on a pathway to universal health care. And we know, again, even from a self-interest and an economic perspective, there's an interlink between health and wealth. And I guess generally for WHO, an investment in WHO, an ounce of prevention is worth a pound of cure. And in the light of that, I think we have to really look at these $400 million and say, $400 million invested now can prevent losses of trillions in the very near future.
Okay, Andrea Feigl, CEO and founder of Health Finance Institute, thank you so much for sharing with us your analysis.